When we think about COVID-19 in Germany, we have 4 questions in mind. How can we understand its spread up to today? What do we expect for the future? What are the effects of public health measures on health and income? And how could an exit plan look like? This 3rd question is maybe the main question for us, because public health measures, this is something the authorities can decide on, and we would like to understand, are they effective and how should they look like? The talk consists of 2 parts. First, we look at the spread up to today, and by doing so, we would like to understand what are the effects of restrictions of social contacts on the spread of COVID-19 in Germany. And then, of course, we would also like to understand, as we are a bit further in health policy, what are the effects of relaxing these restrictions. Then when we look into the future, we have 2 main questions there. First, it's the income-health trade-off that we are interested in now. It's not just about COVID-19, but it's also about production, employment, and anything that is related to income. And then we briefly talk about an exit plan. We have 3 main findings. First, when we think about the restrictions of social contacts, they were in place as of 14 March. Then they indeed strongly reduced the spread of COVID-2 infections in Germany. When we then think about relaxing these restrictions, and this relaxing process has started on 20 April, then we do find some negative health effects, but they are really weak. But when we look at the individual federal states, and not just Germany as a whole, there are quite some differences across federal states. Then finally, this is maybe the most innovative part of this talk, we think about the health-income trade-off. And this trade-off is really very strong. According to what we find, we have elasticities that are way larger than 1. And this trade-off can actually be non-monotonic. What I would like to stress already now is that health-income trade-off is only half of the story. Why? Well, when we think about health these days, we think about COVID-19. But of course, there are many other issues with respect to health, and not just COVID-19. And on the other hand, when we think about income, well, income also has health effects. It's not that income is just simple consumption. So the health-income trade-off is not as straightforward, even on a qualitative level, as one might think. And thinking about this health-income trade-off, we get some idea about how an exit plan could look like. And the point we see there is that we might actually want a second wave, in the sense that I will make clearer later on. So the talk here today summarizes our work on COVID-19 in Germany, and of course also what people did in the literature. We've been doing this work with a lot of co-authors from different disciplines, different universities, and these are the papers we wrote so far, but I don't go through this in detail now. So let's start. The spread up to today. There are 3 regulatory phases when it comes to COVID-19. First, there's an unrestricted spread of COVID-19 before 13 March 2020, so there were no public health measures. Then we had various social restrictions, and of course also restrictions for firms that entered into force on 14 March. And then, as of 20 April, the exit process started. This exit process is much more heterogeneous across federal states than anything that was decided before with respect to restrictions. Our central question here is, do we see effects of these public health measures? Okay, when we first start with the effects of restricting social contacts, then let's remind ourselves a little bit in this second regulatory phase, what were these measures? As of 14 March, there were basically no schools going on anymore in Germany. There were no major sports events possible. And then 1 week later, roughly, restaurants were closed, theaters were no longer open, public sports facilities were closed, as further examples. When we look into the data and we look at effects of these measures, we would expect that these effects are visible 1 week later. Why 1 week later? Well, there's this incubation period, there's an infection, but you see symptoms On average, only 5.2 days later, it's the median to be precise. So there's this incubation period. Then individuals with symptoms need to contact the doctor, then there needs to be testing. So taking all of this together, there should be an effect, if there is an effect, between some measure and what we see in the data of 1 week later. So there should be a delay of 1 week. So our two hypotheses are, when we have the measures on 16 March, they should be visible a week later. When we have the measures on 22nd March, they should also be visible 1 week later. When we look at the data, we can look at these figures, which I guess everybody knows by now by heart and has seen very, very often. We plot the number of reported infections here on a standard linear scale over the period of interest, and we plot the number of reported infections on a logarithmic scale here over the same period. Why logarithmic scale? Well, we understand when we apply the logarithm to a time series, then when the time series is characterized by exponential growth, then the slope of these observations, the circles are the observations, the slope of these observations gives us the daily growth rate of this process. So here with the slope, we see the daily growth rate of infections, reported infections before March 20. Why March 20? Well, when we look up here, we see there's a straight line, constant growth rate per day, and then afterwards, all of a sudden, the straight line is flatter. And then later on, it becomes flatter again. So we do see that on 20 March, we actually had a drop in the growth rate of the number of reported infected individuals. And the same is true on 30 March, and then to some extent on 8 April. So here are our results, same pictures, here are the results. We had not just a reduction in these growth rates, but it was actually large. So as an example, on 20 March, the growth rate, the daily growth rate in the number of infections fell by almost 50%. As these effects in the data are visible 1 week after the policy measures, well, this leads us to the conclusion that public health measures, they were successful in reducing the number of reported infections. Now, let's look at the effects of relaxing restrictions of social contacts on 20 April. We were in a relatively stable regime between 14 March and 19 April. So why stable regime? Well, the rules were relatively constant, the acceptance in the population was large, and the stability of the regime can also be confirmed statistically by re-estimating Gompertz curves at various points in time. Then on 20 April, we relax these restrictions of social contacts. So 20 April marks the starting point of the third regulatory phase in Germany. And we ask, what are the effects of relaxing these restrictions on infections? What we find is the following. Well, first, to be sure, the incidences, they have been falling and they continue to fall since April 2nd. So things are getting better and better and better in terms of number of infections. But the incidence falls less quickly at the national level after April 20. So relaxing restrictions of social contacts comes at some health cost. It's small, but there's some cost. The incidences, they differ strongly, however, across the federal states. How do we see this? Well, let's look at some pictures. So this is a picture you've seen also very, very often. First, let's remind ourselves, incidences have been falling since April 2nd. So these are the Sundays here. This is always the minimum because of reporting and behavioral issues. And all of this goes down since April 2nd. But when we look at our analysis, what happened to this falling incidence, the incidences, they fall less quickly at the national level because we relaxed restrictions of social contacts on 20 April. So relaxing restrictions of social contacts comes at some health cost. How do we see this? Well, we plot again the number of confirmed infections on the vertical axis measured in 1,000 individuals. We start here end of January. The black dots are the observations, and we estimate a Gompertz curve with data up to 19 April. This is this vertical line. And what we get is this red dashed curve here, which just replicates the numbers here up to 19 April, and then we make this prediction for the time afterwards. The green area is the confidence interval at some 95% level. And then we add the observations as gray squares here. And we see that these observations, they are slightly above the predictions, which leads us to the conclusion that there is some small health cost. We emphasize it's really small. When we look at the federal states and we plot the changes there, we have on the vertical axis the number of infected individuals now per 100,000 inhabitants to make it comparable across federal states. Then we have the same green confidence interval. The red dashed line is the prediction. And we see that, for example, in Bavaria, things are very stable. In Hamburg, things are very stable. So our prediction in Bavaria and what we actually observe afterwards, it's perfectly in the confidence interval. So the easing of the restrictions on 20 April apparently in Bavaria didn't have an effect. When you look at Berlin, when you look at Hessen or Thüringen or Sachsen-Anhalt or at other regions, and the extreme example is here the city of Bremen, you see that in some regions the number of infections increased a lot. So this is an indicator that it might be this easing of restriction that caused this increase in the number of overall infections. But let's remind ourselves, at the level of the country, Germany as a whole, the effect is really small to non-existent. Okay, what we expect for the future. So let's go forward. I need to tell you something about the model, otherwise the trade-off between income and health is, I think, not comprehensible. So what is the model? We extended a standard SIR model from epidemiology to allow for the specificities that comes from COVID-19. What are these specificities? Well, it's basically the hidden infections. Infections that are not recorded by authorities. And this is usually not taken into account in standard SIR models. We calibrate/estimate the parameters of the model using, of course, official data by Robert Koch Institute. And we need to make two assumptions on the share of hidden infections and long-run infection rates. We can discuss them at length afterwards. So the model, graphically speaking, to give you a feeling what is going on, we have individuals that are healthy. This is state 1. And these individuals can go in two states. Either they are sick. What does sick mean? That means being infected and being reported to the authorities to be infected with SARS-CoV-2. So there's an infection rate, lambda 1,2, but individuals, healthy individuals, can also go directly into this state of being healthy, state 4, without symptoms or after recovery. So what does this without symptoms mean? Well, these are the hidden infections. So individuals have some symptoms or might not even have any symptoms. They are infected, but this is not recorded and they might not even be aware of it. So individuals can leave the state of being healthy in these two ways. When an individual is sick, two things can happen. The individual can die, or the individual recovers. So that's the model, simply speaking. I need some equations to illustrate the trade-off between health and income. So the central variable in this model is this sickness rate. So the rate with which the individual goes from the state of being healthy to the state of being sick. It depends on a lot of variables, and one variable is this A of t. This is really maybe the most central variable. It's what we call the contact rate. This is the rate with which an individual contacts and meets other individuals during the day, let's say. This is not necessarily this is not the rate with which the individual gets infected. It's just a social contact. When we look at healthy individuals in our models, then we call them simply the employed, as we always do in economics. So the employed in our economy consists of individuals in state 1 and in state 4. These are the states we just saw. What are these states in terms of SIR models? They are the susceptible, they can become infected, the healthy, to put it simple. And then there are the recovered, so the individuals that are healthy again. These are the workers in our model, or at least in our production function at this point. We employ a Cobb-Douglas production function where we would assume there's capital and there's labor, there's total factor productivity, everything we always have in economics. And here we assume over this relatively short periods of 2 months that total factor productivity is a constant and capital is a constant as well. So we merge constant total factor productivity in this constant capital A and the capital stock as well. Then we have labor. We have alpha here. This is the output elasticity of capital as always. And the important thing, and this shows us the trade-off, is we have this little a here, this a of t. This is the same as up here. This is the contact rate. So what's the idea? Well, the idea is simply when we meet individuals, we don't do this only in private life, but we do this also on the job. So having a high contact rate is really a good thing because it increases our productivity. We can supply work, we can use machines, equipment. So this is really a good thing for output, but increasing the contact rate is a bad thing for health because it increases our sickness rate. Then this A is probably not linearly related to output, so we allow for some output elasticity parameter beta. So here we see the trade-off, as I just said. A is a good thing, social contact or contacts with other individuals is a good thing for output, contacts is a bad thing for getting infected. Then we have two measures down here that we will employ to illustrate the trade-off between income and health, and I will come back to these measures in a moment. So let's look at the income-health trade-off. Let's first look at the epidemiological model predictions, and we have these four figures here. I will focus on the figure up there, top left, and right bottom. What is this? We see N2, this is prevalence. This is the number of individuals that are sick at a point in time. Then down here we have the incidence. Up there, top right, we have accumulated incidence, and at the bottom level to the right, we have the number of individuals that will be newly infected over the next month. This is one of our central measures to understand the health income trade-off. So let's understand the figure here. Let's start with prevalence. We start in March. We see here as the black curve, this is a calibrated version of our model to the data, and the fit is pretty good there. We see this unrestricted phase, a strong increase in the number of reported infected individuals. Then we have this first period where restrictions of social contacts are in place. In the model, we set this to the to March 30, and we see here a flattening of the curve. And then we ask, as of April 27, we ask, what is the effect of relaxing restrictions of social contacts? So how do we relate this to earlier episodes? Well, there is a parameter that we call A3. A3 is the rate with which we meet individuals before March 30. So this is the unrestricted area. This is the good old times, so to say. And then we allow, as of April 27, various measures of social contacts between 1% of what we had originally, 5%, 10%, up to 50%. And then we see, depending on how much we relax the measures, we will either have a continuous fall in the number of reported infected individuals, so prevalence goes down, and this red curve is probably where we are right now. So right now we're a bit behind 27 April, so we are here somewhere beginning of May. The relaxing of the restrictions of social contacts on 20 April did not have a strong effect. If we had relaxed much more, then we would have here as the pink or the green curve what is called a second wave. What is now important to understand the trade-off is we need a meaningful measure of health. What is the meaningful measure of health we work with here? It's the number of new infections starting on 27 April. So this is what we plot down here. When we relax hardly, so we just go to 1% of what we heard earlier, then the number of newly infected individuals over the next month will be very low. When we relax more and more and more, and we get to the pink curve or the green curve, then we see that the number of newly infected over the next month jumps dramatically. There are jumps because we employ here a forward-looking measure that looks into the newly infected over the next month. Okay, now let's look at the economic model predictions. What do we see here? We see the following figure. We plot everything over the same time period, and we plot here output. Output in billion euro per day. When we take output of 2019 as the starting point and we divide by the number of days, we have, roughly speaking, 10 billion euro of GDP per day in Germany. When we start end of February, we see that this is basically flat, but it falls a tiny bit. Why does it fall a tiny bit? Well, because output depends on the number of workers, and the number of workers falls because there are some individuals that are sick. So COVID-19 per se has an effect on output through days of absence leave. Then on March 27, we assume here that the restrictions of social contacts come into place, they become effective, and our output per day falls strongly. In our calibration, we assume a 2% drop. Then what do we see? We see then afterwards, in this period where we had this flattening of the curve of the number of infected individuals, we see a further decline in output because there are simply more and more sick individuals. But we also see towards the end of April, April 20 or so, that output is slightly increasing again because the number of sick individuals, prevalence, goes down. And then we see the various scenarios when we relax social restrictions more and more and more. And here we even go to the case where we relax social restrictions by 100%. So we allow as many contacts as we had before any restrictions took place. And then, of course, GDP would go up quickly, strongly again. We see then a non-monotonic relationship because when we allow for a lot of social contacts, then of course this will lead to more sick individuals. So we will have a second wave. So there will be then a subsequent drop in GDP, which, however, will go by. Okay. As I said, where are we today? We are probably somewhere between this red and blue curve. So GDP today probably lies somewhere around here. Okay, when we now combine these two measures, so we combine the dots here on 27 April with respect to GDP, with the dots on the previous slide on 27 April with respect to the number of newly infected over the coming month. So when we combine this, we do a scatter plot, simply speaking, we get this relationship. So this is the trade-off between GDP over the next month and incidences over the next month. So we plot here GDP over the next month. So remember, 10 billion per day times 30 days makes around 300 billion. And here's the number of newly infected individuals measured in 10 to the power of 5. And we see that when we want more GDP, the number of infections will go up. Okay, the trade-off in simple words, and that leads me already to an end. GDP in Germany is, when we compute it per day, as I said earlier, around 10 billion euro per day. We had these restrictions of social contacts now over 5 weeks, or from 14 March to 19 April. This was over a period of 5 weeks. This reduced output by 6%. Where do the 6% come from? Well, there are various estimates by various forecasters, and 6% is sort of a consensus forecast. So this is what we lost. We lost 6% of 35 days times 10 billion euro. This caused a prevalence of 40,000 COVID-19 patients on average over this period, and a total of around 165,000 COVID-19 patients. So the simple conclusion is if we do not want any further COVID-19 patients, we just pay 6% of GDP, so we pay 600 million euro per day. If we want a higher GDP, we need to accept there will be more COVID-19 patients. And when we think about this, this suggests that we might actually want a second wave. Why do we want a second wave? Let me tell you this on my last slide when we talk about the exit plan for COVID-19. What do? We relax restrictions of social contacts. Then we wait for prevalence to reach the acceptable level. Then we relax restrictions of social contacts further on. So we were initially in this period without restrictions. This was the first. So we were first initially in a period where we had some restrictions. Then we started to relax. This is where we are today. And then we will have even weaker restrictions as of next week. In this first period, we had this strong increase, but then a slight drop. Right now, we are still dropping further in prevalence over time. And as of 11 May, well, the reason why I'm saying that it might actually be a good thing, or we should not be worried about a second wave, is, well, we are far away from the maximum that can be handled by the healthcare system in the past. This is what we hear from all clinics, from all hospitals. So if we do not want that this epidemic continues for 2 or 3 years, we would need more infections, because this would allow for the epidemic to go by faster. Okay, let me summarize. Conclusion and outlook. We had 4 questions on COVID-19 in Germany. We had 3 main findings. The restrictions of social contacts as of 14 March, they in fact reduced the spread of CoV-2 infections on this one occasion on 20 March, actually by almost 50%. So this was very useful. Relaxing the restrictions of social contacts as of 20 April only had a weak negative, but only a weak health effect for Germany as a whole, even though results differ across federal states. And when we think about the health income trade-off, it is strong, it's potentially non-monotonic, but it's only half of the story. Income is not just income, but income also has health effects. And we should also focus on other diseases and not just COVID-19. So this guides us towards an exit plan where we believe that a second wave might not be as long as it is below the level that the health system can support, where we believe that a second wave might not be such a big problem. Okay, there's a lot that needs to be done from a scientific perspective. We need extended income health trade-off scenarios. We need to quantify the whole thing. And then we need to understand the effects of individual public health measures. So far, we only looked at the aggregate effect. We need to look at these individual effects, and this is something we work on right now. So that's my talk. Thank you very much for your attention.